topic given to me is quite challenging, and you know, since morning we are listening about family medicine that it could not get the due place in the country in the medical education system. So, in this session, I would like to share my thought on mainstreaming family medicine into the medical education system in India. During this presentation, I would like to take you to the family medicine status in India, the family medicine courses, the medical curriculum, few case studies, and there was an important national consultation, its key recommendations, status of research in family medicine and primary health care, how we can mainstream, and the key resources which are developed. The medical family medicine is a recognized medical specialty in India since 1983, when this National Board of Examination was formed through an amendment in the MCA Act 1956. And the initial curriculum of this diplomate of National Board Family Medicine was derived from the syllabus which was used to be in the IMA College of General Practitioner examination, specifically for fellowship. The family medicine got a lot of importance in the National Health Policy 2002, which emphasized and identified it as a focus area of human resource development in the country, and it recommended that 25% of the postgraduate seats should be in the family medicine in the country, and now we are in 2015, and it is really unfortunate that we have only 2 seats for a country like India, which are MD seats. Right? The theme of family medicine has also been supported by the Mehta Committee report, Prime Minister, National Knowledge Commission, National Rural Health Mission, Task Force on Human Resource Development, Planning Commissions, Steering Committee on Health, and but despite this, we have made progress, but not to the desired extent. And in 2005, the full-time DNB Family Medicine Residency Program, it gained momentum under the National Board of Examination, primarily to support the National Rural Health Mission. Now, if we see the family medicine courses in India, we have National Board of Examination, and I would say that the board is really doing a wonderful job in the country. They have annual intake of 192 seats, which are spread over in 57 institutions in the country. Some of the medical colleges they have tried, like this government medical college, Kozhikode, this NHL Municipal Medical College in Ahmedabad, a medical college in Jodhpur, so they are all in the process of developing their courses. I come from PGI Chandigarh, which is in the northern part of India, and we are also developing in fact, we have developed our course on MD in family medicine, and it is under the consideration of our academic committee, and hopefully in the time to come we are going to start with the MD family medicine. Christian Medical College is at Bangalore is one of the oldest institution which is offering diploma level courses, and they have master in medicine in the family medicine, the postgraduate diploma in the family medicine, which is of regular stream, and then for National Rural Health Mission, and also for the recent MBBS graduates, and also master level courses. The Tamil Nadu Dr. MGR Medical University, they are also having this master in family medicine. I have discussed about this IMA College of General Practitioner, they have diploma in family medicine, and this Apollo Mediversity, they are also having a diploma in family medicine. But keeping in view the large population and the size of the country, this is very small number of the courses which we have in the country. Now, if we see the family medicine in the medical curriculum in India, you will find that this, if we see the undergraduate curriculum, it does not have a specific family medicine component, and that this is one of the reason that people, they do not have orientation when they are the undergraduate student in this country. The MCI regulation of graduate medical education states that the obstetric and gynecology training will include the family medicine, family welfare planning, etc. MCI is having a vision document 2015, although this 2015 is already over. They have recognized the importance of family medicine and talk of compulsory family medicine training, but I have told you that what is the status as of now. Then the skill of present medical graduates which are coming, I mean, you might be aware in the country that perhaps our standard of medical education is declining, specifically in the area of the skills which our MBBS graduate they have. And the main reason for this is that the standard of the internship they have, it has come down over a period of time, and most of the students, when they pass out their MBBS, they start preparing for their MD courses, and in fact they do not have the time to develop their skills. As far as postgraduate curriculum is concerned, and the institutions which are of the medical student, faculty and practitioners, they are not aware of the advantage of family medicine. Just a little bit about the degree which we will be starting, MD Family Medicine in PGI. It is going to be a 3-year course. And again, we have the constraints, so we will be taking only 3 students per year, which is again a small number for a country like this. And out of this, 60% will be for general duty doctors, and 40% will be open for non-candidate. And the important thing about our course is that we intend to have the core faculty in family medicine in addition to the routine faculty, and the course is basically a mix of the major clinical specialty in the medicine and the surgical sciences. This is about the MD Family Medicine in the Medical College Kozhikode, and it was started in 2011, 2 years course. Again, MBBS is the eligibility criteria, and it also have coverage for major specialties. Now, one of the important thing which has happened in the country, that we have now established new aims like institutions in Bihar, that is Patna, Madhya Pradesh, Odisha, Rajasthan, Chhattisgarh, and Uttarakhand by the government of India under the Pradhan Mantri Swasthya Suraksha Yojana, which is Prime Minister's health scheme in our country. And these institutions have commissioned a new department of community and family medicine, and there is a lot of debate is going in the country whether is it a worthwhile exercise to integrate community and family medicine. One of these institutions, AIIMS Bhopal, has identified the development of family medicine program as one of the primary objective. But here again, I had discussion with some of the faculty members, senior working in these institutions. The key challenge is again the core faculty. Is faculty in the community medicine is willing to teach family medicine? Some of our senior, people who are in the community medicine at the professor level, they have stopped even attending to the patients. So if you are asking them to teach for MD family medicine, which is more of a practice oriented and a skill based specialty, so it is going to be a big challenge in our country unless we have a core faculty in the family medicine. Now, the one unfortunate thing in our country is that this family medicine, the academic discipline and the specialty of family medicine has evolved from a traditional medical care, and in most of the countries, the general practitioners and family physicians form the core faculty for the medical education. But in India, the regulatory restriction bar these general practitioners, family physician, medical officer, and other primary care physician from becoming the faculty. So it is very, very difficult. They can't become even the faculty, and this is one of the challenge in our country. And only the doctors with the specialist qualification, and which is now, very few MD in family medicine and the DNB family medicine, they can only become the faculty. And even in some of the states, despite having a clear direction from the ministry, this DNB family medicine, they are not taken as faculty in our country. So there was a national consultation on family medicine program in 2013, organized, and they have given certain very important recommendations, and I thought it appropriate to focus on some of them. And the main objective of this consultation was to bring all key stakeholders and those who are in the licensing and the policy makers together to deliberate on 5 key themes: skill requirement for family medicine doctors, nurses at the secondary level, the family medicine in undergraduate, in postgraduate, in nursing, and governance and regulatory issues. And they made certain recommendations, and these recommendations was for central government. And for central government, the key recommendations were that communication to the state urging them to start family medicine program for the doctors and the nurses. The other was communication to the state urging them to making family medicine degree a desirable qualification. To the state government that they should mandate the medical college hospital to have a department in the family medicine, and they should also issue guidelines for all faculties of family medicine will have mandatory working hours in the rural areas. There were certain recommendations for Medical Council of India that they should relook the undergraduate curriculum for emphasizing the content related to family medicine, and they should also formulate guidelines for recognition of family medicine program. For Nursing Council of India, they should formulate guidelines for recognition of family medicine program and also formulate curriculum for nursing. Similarly, there were recommendations for the national board that they should work with the expert and review their curriculums and strengthen it. And there were recommendations for the universities that they should, recognize family medicine program. But unfortunately, most of these recommendations are still on paper, and we really need to do a lot. Capacity building of available human resources is also a very important issue in our country, and we really need to have more CME, more this type of conferences to do the capacity building of the existing task force. Research in family medicine, primary health care is again a very important area. This is an area of evidence-based medicine and public health, so family medicine is no exception. And research work in family medicine is very, very limited. So we really need to identify the key research priorities. And universal care, as mentioned by Dr. Chandrakant, without strengthening primary health care will be a distant dream, and we should also have adequate journals which can publish this type of research. Mainstreaming is important. We need policy changes. The draft national health policy which is being discussed in the country, they should reflect the family medicine. We need advocacy with the government, with the regulatory bodies, and regulatory focus, because still there are many regulatory barriers in the country. We should implement the recommendations, and we should also develop this partnership and linkages with the other professional associations. We should also try to promote the demand generation among the new students for this specialty, and we should have the long-term workforce planning. I will not go into detail of the universal healthcare and STD because Dr. Chandrakant has amply highlighted. But one thing which I wanted to highlight is that these principles of primary healthcare, family medicine, universal health coverage, They all focus on equity, community participation, intersectoral participation, appropriate technology. So family medicine specialty can play important role, and I think if we do all these things, we can have some mainstreaming of this faculty. From our side, we have developed some of the key resources which are required for family medicine or community medicine people. This book on public health approaches to non-communicable diseases, which is now the major contributor in the country, is the focus. Basically, the UN high-level meeting on NCD agenda is the main focus of this book, and it is available. We have also tried to develop a manual on health promotion, and this was being developed. It has been developed in the 2 districts of Punjab and Haryana, and there are many partners in this: PGI, National Health Mission, Indian Council of Medical Research, health departments of Punjab and Haryana, and the focus is on integration, conversing, and the multitasking. So we have tried to develop one single manual for all national health programs, and this is, you can see, I'll close by saying that this Health Secretary of Punjab is releasing the manual, which happened only during this month. So with this, thank you very much for your patience listening.